we evaluated Polish patients from referral centers treated between October 2013 and December 2020, and in routine clinical practice. It is very important because nowadays we have 3 different combinations of BRAF-MEK inhibitors for treatment of advanced melanoma, which are usually nowadays not used in the first line, except the patients with very extensive disease. Nevertheless, we have dabrafenib, trametinib, and corafenib, Cobimetinib, and Vemurafenib, Cobimetinib, which has been considered as the least tolerated combination because of hypersensitivity to the sun on the skin. But we evaluated the results of more than 270 patients treated in Polish centers, and estimated median overall survival was more than 10 months in Vemurafenib group and more than 1 year in Vemurafenib plus Cobimetinib group. So it confirms that, of course, Vemurafenib and Cobimetinib has longer clinical efficacy. Moreover, median progression-free survival was more than 8 months in Vemurafenib plus Cobimetinib group. And we can achieve significant numbers of complete and partial response because it was more than 50%. What is interesting, the percentage of patients with any grades of adverse events in this group of patients were very similar, and it is in line in the clinical trials. Moreover, we have confirmed in routine practice significant improvement in overall survival and progression-free survival or advanced melanomas, unresectable and or metastatic melanomas with BRAF mutation, were treated outside of clinical trials with Vemurafenib and Cobimetinib as compared to Vemurafenib, and we can assume that the results are in line what we can achieve from clinical trials. So I think that it's very important to perform such real-world analysis because the data from clinical trials usually do not include the patients with poorer prognostic factors, which is standard of care nowadays in treatment of melanoma patients. And however, when we look at the Cobrim trial, median PFS was about 12 months. In routine practice, it was more than 8 months. Nevertheless, still we achieved significant long-term overall survival in about 25% of patients after 5 years. So it means that treatment with combination of Vemurafenib, Cobimetinib probably is at least so effective like other combinations in routine practice and still remain the option for therapy of advanced melanoma patients. Thank you.